Okay, this is Jake back here with Darren. Now we're going to do the cranial nerve assessment. So if you would, Darren, we're going to start with your olfactory nerve. So if you would, close one nair for me. With the other one, yep. Tell me what you smell in this.
Alcohol smoke.
Perfect. Now can you close your other nair? With your eyes closed, tell me what you smell.
Sounds like a Sharpie.
Perfect, good job. So olfactory nerve is intact. Next, we're going to move on to the optic nerve. So I'm going to wiggle my fingers, and you tell me when they're in your field of vision, okay?
Now. Now. Now.
Okay. Cranial nerve 2, the optic nerve is intact. Next, Darren, we're going to do 3, 4, and 6, which is trochlear, oculomotor, and abducens. It actually goes oculomotor, trochlear, abducens with 3, 4, 6. So we're going to start by doing the follow my finger. So if you would, take off your glasses. I'm going to have you follow my finger. And hold for nystagmus. Patient has slight nystagmus when holding out to the right. Now I'm going to do a gaze test. So if you would, just look straight at me. Cover one eye. Uncover, no shift in gaze, cover one eye, uncover, no shift in gaze. Okay, so that was cranial nerve 3, 4, and 6, which is oculomotor, trochlear, abducens. Next, we're going to move on to trigeminal, which is cranial nerve 5, and all 3 of those were intact. Now we're going to move on to cranial nerve 5, so if you would clench your teeth for me. Feeling this temporal, palpating in the temporal and palpating the masseter. Strength is equal. And now we're going to do a light touch and sharp dull test, okay? So here's the light touch. This is what it's going to feel like on your face. You tell me when you feel it, okay?
Okay. Now. 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 Now.
Okay. Light touch is intact. And now we're going to do dull, sharp on your face, okay?
Okay. Sharp. Dull. Dull. Sharp. Sharp. Sharp.
Perfect. So cranial nerve 5, the trigeminal nerve is intact. Next, we're going, since we already did 6, we're going to do 7, which is the facial nerve. So I'm going to have you make some funny faces for me, okay? Can you smile? Frown? Surprised? And scared? And shocked, scared, same thing. All right, perfect. So cranial nerve 7, the facial nerve is intact. If I didn't say it, cranial nerve 5, the trigeminal was intact whenever we were doing the clenched jaw and sharp and light touch. Next, we're going to do cranial nerve 8, which is the vestibulocochlear nerve or auditory nerve. So I'm going to start this tuning fork, and I'm going to put it in the center of your head, and you're going to tell me if you feel the vibration and hear it in each ear, equal and bilateral, okay?
Okay.
Equal and bilateral?
Yes.
No unilateral hearing loss?
No.
Okay. No unilateral hearing loss. Both ears were intact. Now I'm going to start this, and I'm going to put it on your bone. You're going to tell me when you stop hearing it, and then I'm going to put it to your ear, and you're going to tell me when you stop hearing it, okay?
Okay.
So here's bone.
Now.
Okay. Here.
Now.
Perfect. And on this side, bone,
Now.
ear.
Now.
This is called the Renee test, and bone conduction was half the time that air conduction. So air conduction lasts twice as long as bone conduction. Now, and that is cranial nerve 8, the vestibulocochlear, and it is intact. Now we're going to move on to 9, 10, which is glossopharyngeal and vagus nerve. So if you don't mind, I'm going to use this tongue depressor with the trash can. Here it is. Use this tongue depressor, and I'm going to take a look at your uvula. Can you say ah as I depress your tongue?
Ah.
Perfect. Uvula moves when he says ah. Now if you open your mouth, I'm going to test your gag reflex. Ah. Gag reflex is intact. So that is number 9 and 10, glossopharyngeal and vagus. I'm actually going to have you do one more thing for this vagus nerve. If you don't mind, swallow. Take a drink of water and swallow. Do you have any difficulty swallowing?
No.
Perfect. Okay, now we're going to move down to cranial, or 9 and 10, glossopharyngeal and vagus nerve intact. Now we're going to move down to 11, which is the spinal accessory nerve. So for the spinal accessory nerve, I'm going to have you shrug your shoulders. Okay, now shrug your shoulders against resistance. Perfect. Now turn this way against resistance. Yep, turn this way. Come forward against resistance and backwards against resistance. Good job. So cranial nerve 11, the spinal accessory is intact. Now we're going to move to cranial nerve 12, the hypoglossal nerve. So I want you to stick out your tongue, move it back and forth. Perfect. Now if you'll push your tongue against your cheek. Good. 5 out of 5 strength on that side, and 5 out of 5 strength on that side. So that would be cranial nerve 12. The hypoglossal is also intact.